What is that bump on your butt, and when do you need to see a doctor for it? I'm Dr. Karen Zagian. I'm a board certified colorectal surgeon, and I frequently see patients with a bump on their butt in my clinical practice. There are 5 common bumps that we all need to be aware of. The first is a thrombosed hemorrhoid, a bump on the outer surface of your anus that can have a marbly feel or appearance, and it generally will have a blue hue. That's because it's clotted with blood underneath, and generally the pain of this bump will peak at about 72 hours and then generally begin to decline over a period of time. Sometimes these bumps can, however, last up to a month or even longer. Another kind of a bump is a skin tag, or an overgrowth of skin that has occurred from a hemorrhoid or a fissure that you've had in the past. Generally, these are painless, and many people say they've had them for years. However, sometimes skin tags can hurt if there is an active fissure or a tear underneath the skin tag that is rubbing and getting irritated all the time. The other bump is a wart or a condyloma. These generally have a cauliflower appearance. They may be single or multiple, and they may be inside or outside of the anus and are associated with the HPV virus. The other common bump is an abscess or an infection. These generally begin and peak over a period of several days up to a week. They grow in swelling and painfulness, and sometimes they may rupture on their own. However, oftentimes you will end up in our office or in the emergency room with a doctor having to drain and cut out the pus. Sometimes once the abscess is drained, it can form a little pimply appearance that never really goes away and continues to squirt some pus over many months, and generally that implies an anal fistula or a tunnel. The most feared bump is obviously a cancer or a mass, and generally these go under the radar because a lot of people assume that they're just a hemorrhoid and kind of blow it off for sometimes, and sometimes they can be misinterpreted and misunderstood if the doctor doing the exam does not have expertise in this field. Hopefully this is helpful, guys. Please drop a comment and let me know if you have any questions about any of these, and please follow along so that you can see more content like this.